Non-profit organisations have lambasted the Gauteng Social Development Department's plans to cut budgets. They argue this will lead to job losses and a reduction in the services for the people under their care. But the department maintains that NPOs will remain funded. To discuss this further, we're joined by Trienie Drotschie from Tutela Family Care. Trienie, thank you so much for speaking to us. We know the horrific stories in South Africa's past of how social care has not always lived up to the promise that it makes to South Africans in desperate need. Can you give us a little bit of context from your position within an NPO of how you've experienced the communication from the department around these budget cuts and what you understand is going to happen?
Yes, Anli, thank you so much. From our side as NPOs, what happened since September in 2022 is that we were consulted about a monitoring and evaluation implementation on NPOs that needs to comply. And we were happy with the process because we all needs to be audited. And the audit documents and the format was very clear. And that was from the department that was said that NPOs needs to comply. We've implemented the audit tool. There were rumors of the department that will take over foster care and adoption services. And we've inquired many times from the department side, will it happen? How will it happen? In the end, in November, we attended a national meeting where we for the first time received clarity that foster care services and adoption and probably some statutory services will be taken over by the department. And there we were also informed that there was a new priority set from the Premier of Gauteng that NPOs, there's too many NPOs funded and it's services that the department needs to render themselves. By that stage, we thought we were still safe and that if we comply, no one can touch us. And that was the message that was given by our department representatives, that our subsidies are safe as long as we comply. It's only NPOs that doesn't comply. And there was a specific procedure that needs to be followed. If an NPO does not comply, then there will be an opportunity to rectify the mistakes, and then if someone or an NPO does not adhere to that, then they need to cut the subsidy. And Tutela and many of our NPOs that's part of the Gauteng Care Crisis Committee has complied and never gotten any written notification that they're not complying, that we will get subsidy cuts, and we were waiting for our service level agreements. And when we received in the beginning of April our service level agreements, it came to a shock to all of us, because a lot of the programs like older persons and disabilities, HIV/AIDS, crime prevention, their subsidies were cut 100%. Tutela head office subsidy were cut by 53%. And our family care offices, of which is 7 of them were cut with 61%, and 1 family care office didn't receive any funding at all. So it really came as a surprise to us. And there are many, many NPOs that were found in the very same position.
Yeah. I understand a lot of the services that you render are based, or all of the services you render are based in Gauteng, but they cover a broad spectrum from care for the elderly, care to child services, family social services, adoption, foster care. So there's really a broad spectrum of services that you at Tutela provide. How do you think these budget cuts are likely to impact the people who are so dependent on the services that you've been providing up until now?
Tutela is one of the many organizations. This budget cut impact is that our staff needs to be retrenched, our offices needs to be closed down, Tutela is rendering services to 32,000 people in a year, and those people will be left out of service. So it's such a bigger picture, because it's not just Tutela, it's every NPO that renders child protection services, family care services, HIV, disability, crime prevention, family care services, older persons. Every NPO was impacted by that. In the Gauteng Care Crisis Committee, there's not one single NPO that was not affected by this. Now, in many communities, the scenario is that there is either no resources or there's limited resources. And us as NPOs is in many instances the only resource that the vulnerable community members has. And that's the only social service that's rendering services to them. So if organizations like us as Tutela, as SAVF, Child Welfare, Impilo, ABBA Adoptions, Mental Health, FAMSA, if organizations like us, Bethany House, close down, it means we are allocated that area to care and protect. And we are allocated those beneficiaries and communities to care and protect. And they will be left without that care and protection. There will be children abused and molested, and they will not be able to go to the organization and report it and receive help. Our NPOs, the moment a child is reported as being abused or neglected, within 24 hours, we react and we ensure that that child is safe. If our organization closes down, where will those children go? If an organization that renders services to people living with disabilities or with mental health issues, if they close down, where will those people go? Some of the organizations provide shelter or provide facility care. If they close down, many of those people will be homeless and the service will not be able to continue. We will sit with, and that's why we call it a care crisis situation in Gauteng, because the people will be left without care.
Trienie, do you think that the government or the department is not capable of providing these services that they are purportedly taking over in order to capacitate the department?
Well, up to now, we have not getting any conversation with the department in terms of how they plan to do that. How are they going to take over the services? What measures are in place? They had no conversation or consultation without telling us in advance, we are going to reduce your funding or stop the funding. No conversation on what to do with the beneficiaries. Will they take over the beneficiaries? It seems to us as if the beneficiaries is just left to vent for themselves because there's no plan. So we can't say, is the department going to render the service or not? They haven't said anything. They had no conversations with us in terms of that.
We're certainly going to try and get some feedback from the department and from Premier Panyaza Lesufi as to the way forward and the plans to create a transition, because as you say, all those beneficiaries across Gauteng simply cannot be left to fend for themselves. We have seen what has happened in the past.
Yes.
Unfortunately, we have run out of time for this conversation, but thank you very much for speaking to us. It certainly is a very, very worrying situation. That was Trienie Drotschie from Tutela Family Care, providing us with some insights into the cutting of funding of NPOs right across the province.